Bismillahirrahmanirrahim. Quote of the day: do not be embarrassed by your failures, learn from them and start again. Today, the topic of my presentation is Pertussis or whooping cough, and I am presenting it under supervision of my professor, Dr. Sarah Afzal. Learning outlines: epidemiological triad, reservoir, source of infection, mode of transmission, level of prevention, and surveillance system, and recent advances in the end. Learning outcomes. In the end of the presentation, participants will be able to describe clinical features, treatment, complications, and prevention of whooping cough. Now, what is whooping cough? The other name of pertussis. It is an acute bacterial infection of respiratory tract involving trachea, bronchi, bronchioles. And in this infectious disease, there is typical cough lasting for 1 month to 2 months. And Chinese call this 100-day cough occurrence. In the 20th century, this disease was common and major cause of childhood mortality. Before pertussis vaccine, more than 200,000 cases were reported. Widespread use of vaccine has resulted in the decline of incidence up to 80%. Epidemiological triad, agent factors. Agent is Bordetella pertussis, which is a gram-negative bacteria requiring special media for isolation, and it is a toxin-mediated disease. Host factors: age. Infants and preschool children are more vulnerable to this disease, and highest incidence is seen in the children below 5 years of age. And this disease is more among female than male children, and recovery or adequate immunization is followed by immunity. Environmental factors include cases frequently occur in winter and spring, and another factor affecting is overcrowding. Chain of transmission. Reservoir. It infects only man, and cases of pertussis are the reservoir. Sources of infection. It occurs abundantly in nasopharyngeal and bronchial secretions. Mode of transmission are droplet nuclei, direct contact with infected person, and role of fomites is very small. Incubation period. It is 7 to 21 days and it does not expand more than 3 weeks. Secondary attack rate, average 90% in non-immunized household contacts. Pathogenesis. How this occurs, this infectious disease in this bacteria attached to the cilia of the respiratory epithelium and produces toxins that paralyze the cilia and cause inflammation of respiratory tract. Clinical features. There are three phases which are seen in pertussis. First is catarrhal phase, second is paroxysmal phase, and the third is convalescent phase. Catarrhal phase, it lasts for 1 to 2 weeks and it is characterized by mild fever, cough, rhinorrhea, lacrimation. Then comes paroxysmal phase, which lasts about 2 to 3 months, and in this there is paroxysmal cough, bouts of cough, and followed by the vomiting, that is post-tussive vomiting. And then the last stage is convalescent phase, which lasts for 1 to 2 weeks, in which there is gradual reduction in symptoms. At what stage is pertussis contagious? Infected people are most contagious up to about 2 weeks after the cough begins. That is, the paroxysmal phase is the most contagious one. And antibiotics may shorten the amount of time someone is contagious. Complications. There are different percentage of complications in babies and children, and on the other side teens and adults. In babies and children, the most common complication and the most leading cause of pertussis related death is pneumonia, secondary bacterial pneumonia. That is, it occurs in 23% of the affected children. Then is convulsions, apnea, encephalopathy, and 1% of the children die. In teens and adults, weight loss, loss of bladder control and consciousness, and rib fractures from severe coughing. Levels of prevention. Primary prevention, it includes health promotion, that is educate parents, wear masks, develop habits of cleanliness, and avoid contacts. CDC recommends practicing good hygiene to prevent the spread of respiratory illnesses. To practice good hygiene, you should cover your mouth and nose with a tissue when you cough or sneeze. Put your used tissue in the waste basket. Cough or sneeze into your upper sleeve or elbow, not your hands if you don't have a tissue. Wash your hands often with soap and water for at least 20 seconds, and use of an alcohol-based hand rub if soap and water are not available. Specific protection. For specific protection, we have pertussis vaccine. There are two kinds of vaccine used today that help protect against whooping cough, both of which also protect against other diseases, that is diphtheria and tetanus. These two vaccines are DTaP and Tdap. DTaP, diphtheria, tetanus, and pertussis vaccine, while Tdap stands for tetanus, diphtheria, and pertussis vaccine. In DTaP, the point to remember is that T and P, they are used in capital uppercase, which indicates that the vaccine has full strength doses of these parts of vaccine, that is pertussis and tetanus. And in another Tdap, the small case letters are D and P, it indicates that the vaccine consists of smaller doses of diphtheria and whooping cough. And another feature, differentiating feature, is that DTaP, the vaccine starting from capital D, it is a vaccine that helps children younger than age 7, which develop immunity to 3 deadly diseases caused by bacteria, that is diphtheria, tetanus, and whooping cough. And capital T, Tdap, it is a booster immunization given at age 11 that offers continued protection from those diseases for adolescents and adults. These are some differentiating points of DTaP versus Tdap. DTaP, it is for children from 6 weeks to 6 years of age. It is not given after 7 years of age. While Tdap, that is the vaccine with capital T and small d and p, it is for children 7 to 10 years of age, adolescents and adults. And DTaP, it has higher antigen concentration of diphtheria and pertussis, and it is meant for active immunization. And these are some of the examples: Deptacil, Tripedia. And capital Tdap, it is for children after 7 years of age, and then adults 19 to 64 years old for their next tetanus booster, adults with close infant contact, and postpartum women who have not received Tdap, healthcare workers with patients contact. And lower in this vaccine, there is low concentration of diphtheria and pertussis, and it is meant as a booster. Now, components of DTaP, it consists of diphtheria toxoid, tetanus toxoid, acellular pertussis. And pertussis, which is pertussis toxin, filamentous hemagglutinin, pertactin, fimbriae type 2 and 3. And another thing is that DTaP has replaced the older version of DTP, and this is more safer as it does not consist of a whole bacteria, but rather than a part of a bacteria. Preferred injection site. It is currently recommended that diphtheria, tetanus, pertussis immunizations be administered to young infants 2 to 6 months old in the anterolateral thigh, and to older children 4 to 5 years in the deltoid muscle. Whooping cough, vaccinate to protect. So who needs pertussis vaccine? Pregnant women, infants and young children, preteens and teens, and adults of all ages. So the thing to remember is that people of all ages need whooping cough vaccines, not only children. So capital D and T and P, it is for children from 2 months to 6 years of age. Then comes capital D, small DAP, Tdap for preteens, that is 11 to 12 years. And it is also for pregnant women and also for adults who have never received it. National Immunization Schedule. According to it, DPT, the first dose of DPT is given at 6 weeks of age, then 10 weeks, 14 weeks, and the booster doses are given at 16 to 24 months. Mostly it is given at 18 months in API schedule, and the second booster dose is given at 5 years of age. Now, question is, do pertussis vaccines protect for a lifetime? Pertussis vaccines are effective but not perfect. They typically offer good levels of protection within the first 2 years after getting the vaccine, but then protection decreases over time. So public health experts call this waning immunity. Similarly, natural infection may also only protect you for a few years. In general, DTaP vaccines are 80 to 90% effective. CDC estimates that in the first year after getting vaccinated with DTaP, it protects about 7 out of 10 people who receive it. There is a decrease in effectiveness in each following year. Vaccination in pregnancy. Vaccination of pregnant women is effective in preventing disease in infants too young to be vaccinated. National programs may consider vaccination of pregnant women with pertussis containing vaccine as a strategy additional to routine primary infant pertussis vaccination in countries or settings with higher increasing infant morbidity or mortality from pertussis. Vaccination in breastfeeding. Breastfeeding is safe after getting the whooping cough vaccine. A mother can and should get the whooping cough vaccine if she plans to breastfeed or is currently breastfeeding. So, maternal vaccination, this is a systematic review on maternal vaccination against pertussis. According to it, this antenatal vaccine, that is the vaccination given during pregnancy, it induces high antibody concentration in pregnant women, which are efficiently transferred to fetus and protect newborn. And this strategy is safe with no evidence of adverse pregnancy. Recommendation is that this vaccine type, that is capital T and small DAP vaccination, is given in the third trimester, that is 27 to 36 week. And this it was recommended by Advisory Committee on Immunization Practices of the Centers for Disease Control Prevention in the USA, that the combined tetanus toxoid, reduced diphtheria toxoid, and acellular pertussis vaccine, that is capital T and small DAP vaccination, in the third trimester of pregnancy for women who had never received a Tdap vaccine prior to pregnancy. But this recommendation was modified in 2012 to include all women, regardless of prior receipt of Tdap, and with every pregnancy following evidence of waning vaccine immunity after vaccination in the first trimester of pregnancy or in a previous pregnancy. No pertussis vaccine available for infants at birth. There are no pertussis vaccine licensed or recommended for newborns at birth. So the best way to prevent pertussis in a young infant is to vaccinate the mother with Tdap during pregnancy, encouraging people around the infant to be up to date with their pertussis vaccines, and administering the childhood Tdap series on schedule. So this is the current recommendation about the vaccine administration. That is DTaP, it is given 2 months to 6 years of age. Then from 7 years of age, DTaP is given, which is also given to adolescents, preteens, and pregnant women. Now, diagnosis, early diagnosis, it is done through PCR, which has 61 to 94% sensitivity, and specificity is 88 to 98%, and it is rapidly available and available in almost all of the labs, more sensitive than culture, but decreases after 3 weeks and may suffer from contamination. Second option we have is culture, which has 20 to 80% sensitivity and 100% specificity, and it depends on the duration. Sensitivity depends on the duration, that is less after 2 weeks of symptom vaccination antibiotic, and the result usually takes 3 days at least, and it may not be available. And third option is serology. Now, prompt treatment. If clinical history, sign and symptoms strongly suggest disease, and immediate start treatment. If the child or infant is greater than 1 month of age, then we give erythromycin, clarithromycin, azithromycin, while for infants less than 1 month of age, azithromycin is preferred for treatment. Post-exposure antimicrobial prophylaxis, it is done by giving these erythromycin, azithromycin, and clarithromycin. CDC supports targeting post-exposure antibiotic use to people at high risk of developing severe pertussis, as well as people who have close contact with others at high risk of developing severe pertussis. Accordingly, CDC supports the following, that is providing post-exposure prophylaxis to all household contacts of pertussis cases, that is within families. Studies demonstrated that secondary attack rates are high even when household contacts are current with pertussis immunization. So administration of antimicrobial prophylaxis to asymptomatic household contacts within 21 days of onset of cough in the index patient can prevent symptomatic infection, and providing post-exposure prophylaxis to high-risk people within 21 days of exposure to an infectious pertussis case. And high-risk people are those who personally at high risk of developing severe illness or those who will have close contact with people at high risk of severe illness. Surveillance system. Trends. Pertussis is nationally notifiable and clinicians should notify the appropriate health department of all patients with suspected pertussis. Similarly, diagnostic laboratory should notify health department of all positive pertussis laboratory results. And pertussis surveillance goals are to identify cases, to limit transmission setting with infants or others who may transmit pertussis to infants, identify and prevent outbreaks, identify contexts of cases and recommend appropriate prevention measures, including exclusion, antibiotic prophylaxis, and immunization, and monitor the effectiveness of immunization programs and vaccines. So these are the definitions for pertussis from the CDC. That is, clinical criteria is that cough lasting for more than 2 weeks without a more likely diagnosis plus one of the following: paroxysms of cough, inspiratory woof, or post-tussive vomiting, or infants less than 1 year of age and presenting with apnea. And laboratory criteria is isolation of vertitular pertussis from clinical specimen and positive PCR. Epidemiological linkage is contact with a laboratory confirmed case. So a confirmed case is the one who is presenting with acute cough of any duration with isolation of vertitular pertussis from clinical specimen or clinical criteria and PCR positive, or the above mentioned clinical criteria and contact with laboratory confirmed case. And the probable case is the one who has the above mentioned this clinical criteria and absence of laboratory confirmation and no epidemiological linkage. And for infants less than 1 year of age, acute cough of any duration with at least one of the following: paroxysm of cough, inspiratory woof, post-tussive vomiting, and apnea, and PCR positive or contact with laboratory confirmed case. This is a picture of 2019 provisional pertussis surveillance reports. In this, we can see that the reported pertussis cases are given in person hospitalization by age groups, and reported pertussis incidents and cases and reported pertussis deaths are given. And also the reported DTaP vaccine status of children with pertussis aged 6 months to 6 years of age. Recent updates. This is the global scenario as presented by WHO. According to it, 150,1074 cases of pertussis were reported in 2018 all over the world. And globally, 86% of the target population is covered by the DTP3, that is third dose of the DTP protecting against pertussis. And by 2018, 129 countries had reached at least 90% coverage of DTP3 vaccine. In 2019, it was estimated that there were 11,700 deaths globally. Death rates were highest in children aged 28 to 364 days, that is of less than 1 year of age, but declined in this population by 56% between 1990 and 2019. Whooping cough status in Pakistan. According to a study carried out in Pakistan in 2016, the disease incidence was found to be 3.96 in 1,000 infants. This is the picture of children aged 2023 graph showing children aged 20-23 months who are immunized against DTP in Pakistan from 2012 to 2019. And here we can see that the DPT vaccination coverage is found to be 75% in 2019. This is a systematic review that is the optimal strategy for pertussis vaccination. The objective is that severe pertussis infection has been reported in friends before receiving routine immunization series. So this problem could be solved by vaccinating mothers during pregnancy or children at birth. This study aimed to conduct a systematic review and meta-analysis of facilities and real-world evidence to evaluate the optimal strategy for pertussis vaccination. According to this meta-analysis revealed that pertussis immunization during pregnancy significantly increased the concentration of three pertussis antibodies and reduced the incidence rates of infected infants below 3 months of age. Similarly, infants vaccinated at birth had higher level of pertussis antibody than those who were not, and no significant difference in rates of severe adverse events was seen in all vaccination groups. That is, both vaccination groups, the one in which the pregnant mother is receiving vaccination and the other who were just newborn infants. So, pertussis vaccination during pregnancy could protect infants against pertussis disease before the routine vaccination, and pertussis immunization at birth would be an alternative for infants whose mother did not receive pertussis vaccine during pregnancy. However, this immunization to newborn infants is still not licensed or recommended by CDC. Now, moving on to MCQs. MCQ number 1. Pertussis is an acute bacterial infection of respiratory tract. Which of the following is not true in relation to pertussis infection? Most infection occurs during catral stage. B. Secondary attack rate is 90%. C. Subclinical cases are source of infection. D. Infants are susceptible from birth.
Alpha.
A.
Which is not true. C is not true. That is, subclinical cases are not the source of infection. It is the clinical cases, typical clinical cases. MCQ number 2. Whooping cough or pertussis can be a serious disease for people of all ages, but especially for babies. Whooping cough vaccines offer the best protection. Whooping cough offers the best protection against this very contagious disease. All of the following are correct regarding pertussis vaccine except pertussis vaccine provides lifelong immunity. Pertussis vaccine is safe for lactating mother but not for pregnant women. Pertussis vaccine offers good protection for first 2 years of vaccination, then the effect starts declining. And this vaccine is not available or recommended to newborn baby by CDC.
A.
D.
Yes, A is the right
B.
option because it does not provide lifelong immunity.
Yeah.
MCQ number 3. Pertussis is a highly contagious disease severely affecting the children less than 1 year of age. The best way to prevent it is immunization. Following statements are true regarding control of pertussis except isolation of cases, passive immunization of contacts, concurrent disinfection of nose and throat discharges, 14-day course of erythromycin for contacts.
Beta.
Yes, B is the right answer because immunization is not done of contact, rather it is post-exposure antimicrobial prophylaxis is given to the contacts. MCQ number 4. An old month, it is 2-month-old a baby was brought to emergency department with complaints of paroxysmal cough for more than 2 weeks, followed by vomiting leading to apneic spells. Her lab investigations were done to confirm the suspicion of pertussis. Which of the following investigation is readily available in most of the labs with high sensitivity? PCR, blood culture, ELISA, urine culture.
A.
Alpha.
Yes, A is the right option, PCR. MCQ number 5. Pertussis vaccination during pregnancy could protect infants against pertussis disease before the routine vaccination. Which type of vaccine is given during pregnancy and when? Tdap first trimester, Tdap third trimester, Td third trimester, or Dtap third trimester?
B.
C.
No, A is the right option. Because I told you that this type of vaccine starting from capital D, it is given to the pregnant woman or anyone after 7 years of age. Sorry, B is the right option. And this vaccine is given in the third trimester of pregnancy. So B is the right option. MCQ number 6. Pertussis vaccine consists of acellular pertussis toxin available in combination with diphtheria and tetanus vaccine. Which of the following is not true about vaccine administration? People of all ages do not need pertussis vaccine. It is vaccine of choice for children 6 weeks to 6 years of age only. Booster Tdap is given at 11 years. In adults, Tdap any time who had never received.
Alpha.
Yes,
Alpha.
A is the right option. MCQ number 7. Tdap and DTaP are two kinds of vaccines used today. Help protect against whooping cough, both of which also protect against other diseases. Which of the following is true regarding the administration? DTaP helps children younger than 7 years of age immunity against diphtheria, tetanus, and whooping cough, while Tdap is a booster immunization given at age 11 that offers continued protection for adolescents and adults. DTaP is given to children older than 11 years of age as a booster dose, while Tdap is given to children up to 6 years of age. And C is any of them can be administered to child of any age. D is DTaP is only for pregnant women and adults.
Alpha.
Yes, A is the right option. MCQ number 8. A 2-year child with history of contact with pertussis developed bouts of cough, inspiratory whoop, and post-tussive vomiting. Which of the following phase is most contagious? Catral stage, paroxysmal stage, post-paroxysmal stage, incubation stage.
Beta.
Yes, B is the right option. MCQ number 9. Pertussis in infants is often severe. Infants are more likely than older children or adults to develop complications. The most common complication of pertussis and the cause of most pertussis-related deaths is bacterial pneumonia, encephalopathy, epistaxis, syncope.
Alpha.
Alpha.
Yes, the right option. MCQ number 10. A 4-year-old child in a family XYZ develops certain symptoms. The doctor got his investigations done and labeled him as confirmed case of pertussis. Now his family members are concerned about catching the same infection as none of them is vaccinated. What is the secondary attack rate in non-immunized household context? 90%, 100%, 50%, 80%.
Alpha.
Yes,
Alpha.
the right option, please. It is the A. Thank you.
Dr. Meha, this is a message from Madam to unmute her mic.
But I don't know how to unmute participants. Can you please tell me?
डॉक्टर मेया पार्टिसिपेंट्स की लिस्ट पे जाके वहां पे अनम्यूट ऑल की ऑप्शन होती है
मैं कर रही हूँ लेकिन हो नहीं रहा. Ask to unmute. Ask to unmute आ रहा है लेकिन वो ऑप्शन सेलेक्ट